everybody, and I'm very pleased to say hello again because we've invited back Lauren Windas. Now, you may remember, I think it was about a year ago, maybe just over a year ago, Lauren, wasn't it, that we first met? Because I was very interested in Lauren's journey with chronic fatigue syndrome. Now, it's interesting because Lauren is also, well, actually, Lauren, rather than me saying who you are, it's probably better for you to say who you are.
Yeah.
So perhaps if you could introduce yourself once again to our audience to say what happened with your journey with chronic fatigue syndrome and why you've ended up doing what you're doing.
Yes. Yeah. Well, it's a pleasure to be back. And so my journey basically started just over 10 years ago, nearly 11 years ago now, back in 2012. I was 19 at the time, studying English literature at university, and I essentially caught a viral infection and just completely went downhill, essentially. My virus, although we didn't determine actually what it was, I basically had all these kind of acute symptoms, but it's probably one of the worst kind of viruses I'd ever experienced. I was, really flat out, fatigued all the time, had all the kind of flu-y, cold headache symptoms, etc., feeling really bunged up. And it took a really long time to clear, and then essentially went to the doctors. Even though they had the consensus of a viral infection, they sent me home with antibiotics, which was very interesting. Sent me back home to Yorkshire, away from uni, said, go back and rest, because I'm from Yorkshire. So I went back home. And then whilst I cleared out those kind of acute symptoms and I thought I was better, well enough to go back to university, there was still a lingering feeling of not being right. And the symptoms I started to experience was the fatigue. Obviously that hadn't really shaken that off, but it was a severe fatigue, and I was starting to experience a fatigue that whenever I exerted myself, I was met with the fatigue and other symptoms worsening. So I was having things like brain fog. So brain fog being this feeling of almost like a kind of cotton wool headedness feeling, where I felt spaced out, I felt hungover when I hadn't touched a drop of alcohol, and couldn't concentrate. So my kind of worst symptoms was the fatigue and the brain fog. I had digestive issues going on in the background. I had muscle pains, joint aches, dizziness and vertigo, so all weird and strange symptoms. And then I was going back and forth to the doctors, kind of explaining I still don't feel very well, and I was getting blood tests after different tests done, and couldn't necessarily find out what was wrong with me. And at that point, I think was when I actually had a doctor give me a questionnaire to look at my mental health. But I was very much kind of alluding to the fact that it was almost a never been well since scenario. Like, I had this viral infection and I've just never felt well. And of course, that was affecting my mood and other things, but I could kind of pinpoint the trigger. And so that kind of started my journey of just kind of coming to understand like what was going on with me, but almost putting the puzzle pieces back together myself, because I couldn't find the support I needed through the NHS. And actually, it wasn't anybody in the NHS that actually said CFS, said the words ME, said the words post-viral fatigue. It was only through kind of deeper digging myself, and actually I ended up going to see a specialist at some point down in Harley Street who would actually mention those words, even though I never received a formal diagnosis. Anyway, long story short, went on this kind of very long journey and started working with a nutritional therapist and a naturopath myself, and went down this holistic route in terms of, as I say, putting the jigsaw puzzle pieces back together in terms of what was going on with me. And I learned a heck of a lot in terms of my diet, my lifestyle, my gut health, and so many different things. And whilst I won't say there's one solid kind of thing I put as a factor, I was like, okay, that was my aha moment. For me, I learned so much, and I improved over the way to the point where I am now, where I'm recovered. And I just realized there were so many people not speaking about this subject, and I ended up, through this experience, training as a nutritionist, training as a naturopath, which then led me to write my book, Chronic Fatigue Syndrome, Your Route to Recovery, just to kind of explain and contextualize this is an illness that is physical, and there's a lot of history around it that, you know, in the past doctors used to psychologize, people didn't think it was real, but now we are starting to get the science there and the facts that this is a physical condition. And obviously long COVID's now brought that into the you know, into the press and the media a lot more. And so yeah, that's kind of what I do now. I work with clients in my clinical practice, and I support them with complex chronic illness such as CFS, long COVID, etc. That was my kind of, I was trying to make that as short as possible, then I started to waffle on a bit.
No, well, I think it's really interesting because, you know, it is about a personal journey for you, which
Yeah.
means that it's much easier for people to relate to you and you to relate to them. And having looked at your book as well, so here we are, here's my copy to prove as well. What I really liked about your book, Lauren, perhaps if we just talk about, and then we're going to go and talk about some of the content in it, but
Yeah.
just actually talking about the physical book, what I liked about it was very easy to read. And when I say easy to read, I mean that it used terminology that I felt comfortable with, that I could understand. It was a book that one could pick up and put down, but have learned something in a very short space of time. And it's practical. So I like some of your checklists, and I like it's got lots of different things in it. It's a personal manual. It is actually like a manual, I think.
Yeah, like a workbook. Yeah.
Yes.
Parts of it.
And that's what I thought was really nice. And I think when you've got, you know, quite often people write about these subjects, but they forget about the person who wants to read it actually has problems in concentrating. So how on earth could you read some great, big, thick, difficult to read book, trying to get some practical help when your brain's not allowing you to? And I think that's what makes this one different, is it's something that you can understand. You understand what's been, you know, suggested to you.
Mm-hmm.
And I thought that was great.
Yeah, no, thank you.
And the little, as you've just mentioned to me, in it, some of the chapters or some of the paragraphs, there's these two little they're like pause buttons, and I was sort of thinking what they were. And Lauren's just explained to me that actually that's like take a breath, isn't it? Take a moment.
Yeah, take a pause, because obviously the idea behind, and we'll go on to talk about that, is this idea of kind of rationing your energy envelope and not biting off more than you can chew. So especially with a book that's this thick, you know, I was obviously trying to pay careful attention to making that easy to understand for the lay audience, for those that are dealing with fatigue. Obviously it's a very complex subject, there is science involved that I've tried to break down into easy to understand little bites of information. But obviously those pause symbols, if you kind of follow those is like, that's your cue. Walk away from the book, have a cup of tea, you know, have a break, and then come back to it, because it's a lot for the brain to take in anyway. And if you have CFS, then that's going to be even more challenging and taxing for your mental capacity and your cognition. So yeah, it's meant to be kind of easy to understand, and breaking that science down, so that everything that I've talked about, if I've mentioned a word, I've tried to kind of explain what that word means, just to help people kind of along the way, because obviously all this jargon, we're not necessarily, unless you have a science background, we don't necessarily know it, and we don't learn it, you know, at university. So yeah, absolutely.
So you know, so the book is basically divided into sort of 3 to 4 parts, and you know, the first part is about your own journey. And what I think is nice is that through the book one can hear you talking, which is a really nice thing. But then the next bit goes on to actually tackle the science part of it. So, you know, perhaps you'd like to explain some of that science. What is chronic fatigue syndrome to start with?
So essentially chronic fatigue syndrome is it's a physical condition. We can say that with confidence, even though there was this background that it was considered to be like a psychological condition. We do now have evidence to say that it is a physical condition. And there are debates as to kind of the origins of what causes CFS and what it is. And we do have information and understanding, which I contextualize in the book, of kind of the science of what we know so far. But it's essentially, first of all, it's a chronic, complex, multi-system illness that affects different areas of the body and different systems of the body, from the nervous system to the immune system to the digestive system to the neuroendocrine system to also our mitochondria, which are our little energy factories within our body cells. And the way that I like to talk about it in the book is this kind of, it has like this three-pronged structure. So I like to call it the 3 Ps. So in terms of kind of what we know so far about, I guess, what causes CFS, as I say, we don't fully understand what causes chronic fatigue syndrome, but we do have some avenues. And when I say about these 3 Ps, this means a genetic predisposition. So predisposition, we do have some evidence to say that there are genetic links that can make somebody more or less susceptible to developing CFS. And there is a large study going on at the moment in the UK called the Decode ME study, and that is looking at features in people's DNA that make them more or less likely to develop CFS. So that should garner some brilliant insights, but we do have a few studies that kind of show that there is these genetic associations. Then the second P is this precipitating trigger. And this is very much kind of what happened to me, was this trigger episode of a viral infection. Now, for some people, it doesn't necessarily have to be a viral infection. It could also be a parasite or parasitic infection. It could be a bacterial infection. It might not necessarily be an infection that is the kind of trigger episode for you becoming unwell. It could also be you've been involved in, say, like a car accident, you've had like a stress or a trauma, or a surgery, for example. I've had clients come to see me who have kind of that classic never been well since scenario, since this happened and then I became unwell and I was bedridden and etc. I had this whole cluster of different symptoms, and I can go into kind of, you know, some of the key symptoms of CFS as well, which is obviously fatigue. But one of the key things to say is that it's not just fatigue. And, you know, a lot of people who maybe don't necessarily know a lot about CFS is that people just think it's, oh, you're tired all the time. And people might patronize you and say, well, we all get tired. But first of all, it's a profound, very debilitating fatigue. And for some people, they can be bedbound, housebound with the illness, and they can be very severe with it. But also the symptoms are very widespread. So as I said, you can experience muscle pains, joint aches, brain fog, fatigue, dizziness, all things like heart palpitations. And one of the key cardinal symptoms of CFS is this situation called post-exertional malaise. And that's kind of one of the key defining features of the illness, which is where any form of activity or exertion that you do, you're met with this this overriding feeling of, you know, let's say you've maybe walked to the other end of your garden, or you've walked to the local shops. As a result of doing that activity, you're back in bed, or you're fatigued, or your symptoms are worsened and exacerbated as a result of it. And some people have different thresholds than others. So every CFS case is different, and some people can be very intolerant to activity, to the point where maybe they brush their teeth or they get in the shower and then that crashes them out and they experience post-exertional malaise. Sorry, you're going to say something?
No, I was just saying I didn't realize how extreme it can be, and you know how frustrating that must be, and the toll on your mental health.
Yeah,
but I'm sure inside all you're doing is go, I just want to be better, you know,
exactly.
just to have a normal life.
100%. And that's the thing. And when people kind of get this association with CFS as, oh, it's just tiredness, you know, it's really, really life limiting for a lot of people, especially those who are severe, because it's also worth highlighting that CFS is like a spectrum disorder. So it affects people. Some people might be mobile, they might be able to go to work. Some people might have to go to part-time work because of their health. And then others are unable to, you know, works out the question. They are bedbound, housebound, and some people require full-time care and support. And those are kind of the severe 25% of the ME/CFS population are those kind of severe cases. And, you know, it is very worrying. And obviously pre-COVID, this wasn't even being spoken about very much. Now it's coming more into the limelight a little bit. But again, you know, research needs to kind of catch up, and understanding, and especially for those types of patients, you know, it really is life limiting, and they need to do something about this in terms of supporting it with research and treatments, because at the moment there's, you know, really a lack of support. And so anyway, going back to my third P, which kind of contextualizes what we know of CFS is these kind of, I like to call it these perpetuating factors. So that's the third P. And how I like to kind of outline this is like almost a bit like an umbrella. And this is, I call this dysregulation. And basically in every single body, we have different physiological systems. So we have our nervous system, we have our digestive system, we have our immune system, our neuroendocrine system, which is our hormonal system, and we also have our mitochondria, which are these little energy factories. And what we're starting to see within the research within CFS is that there's evidence within different cohorts of people. So it might be the case that as I say, that CFS is like an umbrella. So there might be some people that have one of these kind of imbalances. Some might have various different imbalances in these areas. But what we do see is that in a lot of people with CFS, they have this autonomic nervous system dysfunction, which is essentially where their nervous system is kind of predominantly firing a fight or flight state. So their body's in this kind of sympathetic overdrive. And as a result, if your nervous system's firing kind of, cortisol, and you're getting all these stress responses, you're going to feel fatigued, you're going to feel digestive systems, your immune system's not going to be working the way it should. These are kind of explanations to how, if your physiology goes awry, you can experience all these different functional complaints. So we start to see that. We've seen evidence of like hormonal imbalances. So people with thyroid insufficiency, so like lower levels of thyroid hormones, even in the absence of, say, like a hypothyroid state. Adrenal issues, which are basically the glands that sit above our kidneys, and they again fire that kind of central stress response, so they can become almost flatlined to the point where if you're constantly firing this fight or flight state, then they start to struggle because they're being almost like strained. So we have this kind of adrenal insufficiency. We also have seen increased levels of inflammatory cytokines in CFS patients. So like these are kind of inflammatory chemicals, and they're heavily linked with feelings of fatigue. And they are what we essentially get whenever we experience like a virus. These are kind of, they flood the body, and it's called like a cytokine storm. But when we see higher levels raised in CFS patients, that might also be an explanation for the fatigue that people are experiencing, and the malaise and the flu-like symptoms. But also, it might be the case that in some CFS patients, and some that I see, that we can have like chronic infections. So either there's an autoimmune reaction to an infection that you've had. You might have, say, cleared the infection and you've not got the infection anymore, but your body's still reacting as though that pathogen is still there. And then there's also the explanation that, you still have that infection somewhere and it's laying dormant within your cells, but then coming and reactivating and kind of causing these relapsing and remitting symptoms. So it's why sometimes people go through periods of ups and downs in their health. Things like mast cell problems. So people, a lot of people with CFS can experience allergies as well. So some of this obviously just kind of showing you how complex.
Yes.
And that's why I like to say it's a bit of a web and like a bit of an umbrella. And then with the mitochondria, these little energy factories, we've seen like reduced levels of ATP, and ATP is our energy currency compound. So if this energy currency compound is not being made quick enough at the rate to which the body demands it, and we can't supply it quick enough, this might also be an explanation behind that key symptom in CFS, which is post-exertional malaise. So your body needs energy, you're not giving it quick enough, therefore you say walk to the shops, walk to the other end of your garden, and then you're back in bed because your body is not creating that energy molecule quick enough. That's potentially one theory behind this post-exertional malaise symptom. And then we see this kind of my final, I guess, little piece of the pie here with the dysregulation piece, is that the digestive system, and obviously I'm really keen on working on gut health with my clients, and in the microbiome we've seen reduced diversity in those patients with CFS of the bacteria, of the beneficial bacteria, and lower levels of bifidobacteria, which is a type of commensal bacteria that help to regulate our immune system and keep our gut lining in check. And we also see kind of this inflammation as well happening within the gut. So these are kind of all the pieces of the, I guess, the jigsaw puzzle. And whilst we don't know everything, this kind of helps us to kind of look at, okay, how can we find a root cause approach? And that's kind of how I work with my clients clinically, is that I look at every case as different. You know, everybody has their own unique journey of how they became unwell, what caused them to get to where they are, and also maybe what's driving that, you know, what's their underlying imbalance. And that's kind of where I work holistically at a root cause approach, and that's kind of using that functional medicine model. So that kind of contextualizes a bit of the science of what we know so far with CFS.
So I mean, I'm a great believer in functional medicine, of understanding the person, and then let's go and look at what the issues, etc. And so once you've described in your book the, you know, the science behind it, which I think gives one a good foundation and base of understanding what's going on. Right, got all that. Now I understand it, but how am I going to get better? How am I going to improve? And we say get better, and it's like, as you say to yourself, you say that you're recovered. I think you've said previously that you're not how you were. But you'll never go probably back to where you were
living the same life. 100%. And sorry if I interrupted you there. Now, I was just going to say, for me, and I really highlight this clearly in the book, because there are a lot of people that can take, I don't know, maybe take personally the word recovery, because sometimes people think recovery means cure. And by recovery, I certainly don't mean cure. What I'm referring to here is that recovery to me is an upward trajectory towards improved, better health. And for me, recovery can be partial and it can be full. A full recovery can be a 90 to 100% reduction in symptoms and a full return to functioning in life. And that's what I say. I say I'm recovered. So that's kind of a full recovery. And a partial recovery is more where you're still experiencing those PEM episodes, those crashes, and that's obviously happening more often and kind of close together. And what I like to work on with clients is building their body's resilience. And what we know as well is that there is evidence that other people can recover. And I like to kind of arm people with that information, because when they believe that other people can achieve this too, there's no reason to say that they can't as well, is really improve their resilience and help to reduce those crashes from happening. So that's what I like to work on with clients. But certainly the word recovery is about focusing on an optimistic viewpoint that health can be improved and exacerbations and PEM can be reduced to the point where you can start to integrate into the daily activities that maybe you weren't able to do before, and you start to able to live a fuller life.
So what would you suggest is, some of the first things for people to go and on their road to recovery that they should look at? I mean, are there sort of things that are really obvious and actually are sort of the low hanging fruit that people should do straight away?
Yeah, so I think one of the first things that I like to work on with clients is really kind of information taking to kind of understand exactly kind of what is going on for them as an individual. So we kind of walk around the background of exactly kind of how they lived their life beforehand, what was the triggering episode, or was there one that made them to get to the point where they are now in terms of their CFS. We might explore things like functional testing, and functional testing is essentially a form of testing. It's not available on the NHS, but it's a form of testing that essentially looks at how the body is functioning. So I might say, for example, recommend we do like a stool test to look at the microbiome. We might do some testing on chronic infections. I use a special lab in Germany, which are really brilliant at assessing for infections that if there's anything where the body's having like an ongoing response to that, say NHS antibody tests aren't necessarily picking up, and that's really helpful for things like Lyme disease as well. Or we might test hormones. We might do a full thyroid panel, because again in the NHS they'll only test, say, your TSH and your T4, but not your T3, which is your active thyroid hormone. So depending on kind of what a client has going on, there might be a recommendation to do some functional testing, and that gives us more wealth of information to go off in terms of, okay, where are we going to target support? Definitely, obviously, dietary interventions are really key. So working on reducing the inflammatory burden within the diet. So if somebody's eating a lot of refined, ultra processed foods, and there's a high alcohol, high sugar intake, maybe a lot of caffeine consumption. We try and reduce that down and get them, especially something that's implementable as well, because we don't want to add too much stress to their system as well in the first instances. But really working to kind of reduce that down and making sure they're eating balanced meals that are high in protein, high in fiber, and they're getting to a diverse diet that's really working to help to alleviate those symptoms. And actually in CFS, we do tend to see a lot of food intolerances and sensitivities. So sometimes, that's a good case for kind of taking things out just for a time period to give the gut and the immune system a bit of a breather. And then when it comes to kind of more broadly on lifestyle, things that I'm really, really kind of hot on is working on pacing. And pacing is actually one of the support tools that is offered within the NHS for, say, like long COVID clinics, I believe, and also obviously ME/CFS. And pacing, is essentially an energy management strategy that seeks to find the balance between activity and rest. So it might involve, for a period of time, just living within the limits of your illness and avoiding the activities that exacerbate your symptoms. So it's essentially giving your body breathing room to help its energy reserves recoup. And one of the ways that I get clients to do this is to find their baseline. And a baseline is essentially the level of activity that somebody can complete without feeling any sort of symptoms occur, or like post-exertional malaise. So if for example, that if you go walk for 2 miles, that you will start to feel post-exertional malaise, what is the point where you don't? So it's kind of finding that baseline level of activity you can do. And then I talk about something called the 75% rule. So basically dropping that back by 25%, and that level of activity, so that you've got this breathing room. It's almost like when we're budgeting, you wouldn't want to, if you had £10 to spend each day, you wouldn't spend, if you're trying to save money, you try and spend maybe £7 instead of 10. And it's giving you this kind of window for for a rainy day, but also to help recoup this energy. And so that's all about pacing. And I try to get clients to complete, an activity diary to let me know, like, what activities are you doing in your routine that are, say, 1, energy building, 2, energy neutral. So there might be something that you don't really know if it builds or takes your energy. And then some that are energy draining, and trying to incorporate at least 4 things that are energy building each day, but also reducing down the ones that are energy draining. I mean, it's context dependent as well, because let's say one day you may be watching TV and you're watching like a comedy and that's energy building, or you're watching a horror film and that's energy draining. And it also depends on how our mental state can be as well, because as I say, as day-to-day things change, you might be playing with your kids and one day that builds you up, but another day that drains you. So it's trying to figure out and understand contextually that the things you're doing day in and day out, and how they're kind of building your energy reserves up and how they're draining you. And obviously there'll be certain tasks that we have to do day to day that are kind of essential for daily living. Maybe it's kind of cooking our dinner, or going to the shop, or doing day-to-day chores and things like that. And how can we reduce the things that are, say, non-essential, or ask for help where we need to, and just really work on, as I say, having that balance, I'd say. So going back to pacing, then this is all part of kind of the pacing picture, is trying to reduce down the things that drain us and increase the things that build us, but you're giving yourself that breathing time by not kind of going past your threshold. And then when it comes to activity and exercise, well, the first thing to say is that activity, like physical activity and exercise, are 2 different things, even though they slightly overlap. So physical activity is any kind of bodily movement where there's like use of the muscles. It might be like standing up, emptying the dishwasher, making the bed, for example. And then exercise is any form of physical activity that is based on improving your fitness. So that could be running or lifting weights, for example. And so one of the key kind of things to emphasize in CFS is that, particularly in the early days, especially when you're in that crash stage of recovery, when you're kind of really I guess in the crux of your symptoms, maybe your fatigue's at an all-time high, you're probably bedbound at that point, because this is kind of the early on experience of when you've just become unwell. It's really important to not overemphasize any return to exercise. You've got to be really, really careful with that. And there was a form of treatment within the NHS called graded exercise therapy, and it's recently been scrapped because it was consistently making patients worse. And there was a lot of outrage around it, and it was very, very controversial, and they took that out now. But what it was doing was it was forcing patients to essentially follow an exercise regime, even if symptoms were increasing. So it wasn't listening to the body. So we have to be very careful when it comes to introducing exercise. And during CFS, in the crash stage, it's more about listening to when the body is able to incorporate a bit of physical activity. It might be gentle limb movements, it might be standing up and sitting down, or some, gently walking around the house just to get the body moving a little bit. And it's not overemphasizing too much rest, but if the body needs the rest, then obviously allowing that to happen. And then during kind of the next phase of recovery, we enter something called this wired and tired stage, which is where energy is coming in and you're starting to see a little bit of energy going in, but a lot of it goes to the nervous system. So you're kind of feeling this kind of wired and tired effect. And this is where you see this boom and bust cycle, which is often where people say, to me, like, oh, I had so much energy the other day, so I decided to go meet my friend. I went for a run and I did this, but then I was back in bed on the following day. So they see, it's almost like seize the day, like you get some energy back and then you overspend it, and then you flatten your battery essentially. And so during that stage, it's all about focusing on restorative movements that really help the nervous system to rebalance. So hatha yoga, maybe some walking or brisk walking if you can manage it, but nothing too intense. Maybe some Pilates or some yoga, for example, and some stretching. And then during that next phase, when you're starting to reintegrate and those crashes of, that boom and bust is more under control, and that's when you can start to, really grade up your activity. But it's about maintaining a level of new activity for, say, like a 2-week period before you even challenge another grade again, because you really don't want to stress the nervous system, stress the system out to the point where you end up back in that boom and bust. Does that make sense? It's a lot of information, but it's about personalizing it to that person and where they are.
It is, and it's much easier for you to see it when someone's explaining, I'm sure, than the person themselves. And I can see why it's so important to write down these things. This is what I was doing this day, because quite often people don't equate the two, and then you suddenly start seeing the pattern. And it is about listening, but making sure you record at the same time what you've done, how you feel, and then going on to the bit that I really liked, as you know, because I've mentioned to you, is the troubleshooting that you always have in any kind of, if it's technical or whatever it is, you've done what it says and there's still a problem. And that's what nice, that you've got some real practical troubleshooting at the back. What's a typical question that people say, well, I've done what you've said and look at me, it's not working?
Well, a lot of people say I've tried everything, and when it comes to kind of lifestyle, dietary intervention, I've taken this supplement, I've tried that holistic therapy, I've tried this, I've tried that. And I totally get it, because in my scenario as well, like I tried so many things and I was like, I've literally done everything. But the chances are you probably haven't tried everything. And maybe also you've not necessarily tried things at the right stage of your
the right way.
And I also think sometimes one of the key pillars of recovery I like to talk about is the mind, the mindset side of things. And it's this mind-body connection, because when you understand a physiological problem, we're talking about in CFS this idea of dysregulation, your systems are kind of out of whack in a way. And so what's happening is that somebody at the door, the dog's barking.
I just saw them.
I was say probably saw it out the window. But what we're dealing with is this dysregulation. So if we can get the brain to start helping to influence that central stress response and just calming down that nervous system, that can have a really profound impact on symptom alleviation. And it's not to say that this is psychological, it's just to say that we can influence our physiology, because obviously the mind and body are connected. So we know this, and how we can really calm down that central stress response. But going back to, I've tried everything, often, as I say, we haven't, and sometimes we haven't tried things in the right way, or maybe we're not thinking about it in the right way. Maybe you're trying to focus on, say, I don't know, an element, whether it's pacing or, sorry about the dog, whether it's pacing or breath work or something, but your mindset, maybe you've got a block there that's, you don't believe recovery is possible. And I've worked with a lot of clients that don't think recovery is possible. Sometimes people think, oh, I know other people can get better, but I don't think I can get better. And there's a difference there. So it's like, what are your hurdles that you are yet to overcome? And a lot of other people say to me like, oh, I'm never quite there yet. So I always say, always consider the progress that you've made so far, because the chances are like you will have made progress. Even though if it looks like it's minute, sometimes people think that that's not worth celebrating, but actually it's a huge step. And if you've got the evidence that improvement can be made, then you also have the evidence that recovery is possible. And as I say, recovery isn't necessarily like this quick fix where you wake up one day and like cured. And actually, you know, what is perfect health? Sometimes we do perfectionism on what the best form of health looks like, because especially when you're dealing with functional complaints, we become so tuned into every different physicality of like every element and symptom our body's experiencing, so we filter for symptoms. And I mean, how many people walk around day to day with the odd maybe little digestive niggle, or a little twinge of a headache that lasts a couple of minutes? But sometimes in CFS we start to filter for that, and we think, oh, it's the brain fog coming back, it's the fatigue. And again, fatigue wise, we have to make firm friends with fatigue, because fatigue is a symptom that everybody experiences day to day, and obviously not necessarily on the same level as CFS patients, but it's something that we need to, understand that there are different types of tiredness and there are different types of fatigue. So if you learn to contextualize, oh, that's not CFS fatigue, this just because maybe I've had a long day.
Tired.
You're just tired, or you know, exactly, or you've maybe not slept well last night, or maybe I didn't eat very well and my blood sugars are imbalanced, for example. But I always say, like, always inspire yourself forwards, but measure yourself backwards. That's like a really kind of key quote I like to use with clients, because you've always got to keep moving forwards on that journey, and that recovery journey, but always measure your progress backwards. Don't look at how far I've got to go. Oh, well, I'm still not there. And then you kind of measure your success on that. Actually look at the journey behind you. And actually, I did improve from when I was bedbound. I'm now back at a part-time job. I'm back at, I'm able to, and for me, I said, like, I was able to run a marathon. I was able to write a book. Like, I was able to train as a nutritionist and do all of these things. And so if you measure yourself, keep moving forwards to where you want to be in your goals, but always measure yourself based on what's behind you, because that's what you want to, that's what you want to celebrate, essentially.
Yeah, no, and I think that's very, very wise words. And I have heard them used before. And it was something I would always say to people, because things also never linear lines anyway.
Yeah, exactly. And health is non-linear, and nobody wakes up from a chronic illness and magically is, quick fix, and it's like this black and white. It doesn't work like that. And obviously, as I say, a recovery can be full or partial. And if it's partial and you're still experiencing those frequent post-exertional malaise episodes or those crashes, it's about focusing on the idea that, it's never static. You can always be moving forwards, and a full recovery can also be on the horizon in the future. And you've just got to look towards that. But, we can still talk about recovery in these terms, and it doesn't mean, oh, cure, quick fix, that sort of kind of terminology that sometimes people think recovery is like this kind of false promise. And it's certainly not that. And it's focusing on an optimistic viewpoint that actually people can improve, people can get better, and they can certainly return to a more fully functioning life from those severe symptoms that they've maybe had in the past.
Well, and I'm sure that reading your book will get people there quicker.
Yeah, absolutely. And I really hope it just gives them validation in what they're going through, and understanding, and also outlets and solutions that actually you can empower yourself forwards, because sometimes we think our health is in a doctor's hands and that somebody has to fix us. And I think a lot of, especially in this scenario, and I obviously speak myself from firsthand experience, I'd say it's a lot about suspending your disbelief that actually you've got to do a lot of the work in terms of the inner healing, focusing on those kind of limiting beliefs. You're looking at your diet, making a lot of changes which actually might seem difficult and it might feel like work, but as I say, if you focus on those like positives that you've gained from that situation, you always measure yourself backward. You think, actually, I've gained all these skills that maybe I'd have gone down a path where I'd have eaten, you know, maybe a really westernized diet. I'd have probably had a really kind of unhealthy life, and then maybe 10 years down the line you're met with another form of diagnosis. And you know, actually, if you think about it like this, you can prevent a lot of chronic diseases like type 2 diabetes, obesity, and things like that, just through learning all about this model of functional medicine, dietary and lifestyle shifts that can really empower you for a positive state of health moving forwards.
On that note, I'd like to say thank you very much, Lauren, and
Thank
hope to
you.
see you again in the not too distant future. And yes, I would highly recommend your book, even if you don't have chronic fatigue syndrome. It really makes you think, really makes you think.
Yeah,
Thank you very much.
Thank you so much for having me, Katrina.
Thank you, everyone.
Thank you. Thanks for
Bye.
listening.